When you arrive on the day of your scope, enter the hospital through the Polson Tower and head directly to the patient registration booth. Here they will give you some paperwork that you can bring with you past the coffee shop and into the ambulatory care department. You will be greeted by one of our unit clerks at the main reception desk. Here they will verify your ID as well as the procedure you will be having. This is where your ride will leave you unless they are required for interpretation, mobility, or with your medical history. The clerk will then tell you where to sit as you wait for the next steps. A staff member will come explain how to change into the gown. For a gastroscopy, take off all your clothes from the waist up, including undergarments. You will then put the blue gown on, tying up at the back, the brown housecoat over top, and blue booties for over your feet. You can place your shoes and all of your clothing in the blue pillowcase and bring it back with you to the blue chairs where you will wait for the nurse to bring you to the next step. The nurse will then come and verify your ID as well as the scope that you will be having and take you to the admission area. Here they will ask you when your last food and fluids were, your medical and surgical history, any allergies, what medications you take, including blood thinners, and your last dose. They will also verify your ride home and who will be staying with you for the next 24 hours. If you are a diabetic, they will take your blood sugar at this time. They will also start an IV in your right arm. This will be how you get your medications during the procedure. When they are ready for you, a nurse will come and greet you. They will once again verify your ID as well as the procedure you will be having. They will take you into the endoscopy room and get you to sit on the side of the bed while they apply a blood pressure cuff as well as some other equipment. You will get some oxygen in your nose and some fluids to start through your IV. You will be given the medications once you have spoken to the doctor. They will then lay you flat on your back, and some doctors do give what's called a lidocaine spray for this procedure. If you are to receive the lidocaine spray, you will get 2 doses sprayed into the back of your throat. This is to help suppress your gag reflex. With this spray, you cannot eat or drink anything for 1 hour, and they will go through that with you in recovery before you go home. Once the spray has been done, they will turn you on your left side and they will bring the doctor in to speak with you before he starts the procedure. If you have any questions, I recommend asking at this time before they start the procedure. Once everyone is ready, the doctor will order some medication through your IV. We give what's called a conscious sedation here. It is not a full general anesthetic. The main goal with these 2 medications we give are to keep you comfortable. We give a painkiller as well as a medication to help relax you. Regardless of how sedated these medications make you, you are considered legally impaired for 24 hours. So this means no drinking, no driving, no signing any legal documents or any drugs for the next 24 hours. As the medications are going in through your IV, the nurses will also put a bite block in your mouth. This is to help keep your mouth open, as well as to protect your teeth from the scope and the scope from your teeth. Once the bite block is in and the doctor is happy with your level of sedation, he will start the scope. You will feel the scope go to the back of your mouth and you will feel some pressure in your throat. They may ask you to gulp to help the scope go down. Once the scope is down, just remember to breathe through your nose, and this will help suppress any further gagging. The procedure usually lasts about 5 minutes. They will go down your esophagus, into your stomach, and into the top of your small bowel. If they feel the need, they will take some biopsy samples, and if they see any polyps, they can also remove those as well. Any samples will be sent straight to the lab to be analyzed. We usually get those results within about 4 weeks. When the procedure is done, they will pull the bite block out of your mouth and they will wheel you out to recovery. When you arrive in recovery, the nurses will go through all of the paperwork with you. They will let you know what was seen and done during the scope and if any samples were taken. They will also remind you that you are legally impaired for 24 hours. They will then test your gag reflex by letting you try some small sips of water. As long as the water goes down okay, you are allowed to eat at your specified time written on your discharge paper. If you have any problems with the water, the nurses will give you further instructions. You may not remember what happened during the scope. That is normal from the medications we have given. When you are at home, if you experience any difficulty breathing, sudden fever, vomiting, chills, or coughing up any blood, please go to the nearest emergency department and let them know that you have had a gastroscopy done. You can resume all of your normal medications unless otherwise told by the healthcare team. Now that you know how the gastroscopy works, if you have any questions regarding the procedure, please ask any of the healthcare staff.